day, ma'am. I am Crystal Jade S. Busmion, your student nurse from G.H. Cirillia State College, Pagadian, and I will be assessing the head and neck for today. Hello, ma'am. Good morning. I am Jade, your nurse for today, and I will be assessing your head and neck. Before we formally start, ma'am, can I have your basic personal data first?
Okay.
Okay, so what is your name, ma'am?
My name is Kristen K. Busmian.
Okay, so age,
I'm 22 years old.
date of birth,
June 17, 1998.
municipality.
Poblacion Margo sa Tubig, Zamboanga del Sur.
Okay, for your mobile number, ma'am, kindly please fill up here for your record.
Sure. Here.
Okay, thank you, ma'am. So how are you, ma'am? I mean, how's your feeling for today?
I'm good. I'm wonderful.
Wow, that's good. For today, ma'am, I'm gonna doing an assessment of your head and neck. For us, we can be able to know if there is abnormalities or developing illnesses in your body so that we can focus on it and treat that immediately. Okay, ma'am?
Actually.
And I can assure you, ma'am, that the result will be confidential and it will only be discussed formally to other healthcare professionals.
Okay, thank you.
For the last time, ma'am, I have only two further questions before we go to the assessment. So, do you have any past experiences of consciousness, dizziness, or frequently headache?
Well, dizziness and frequently headache I do, but not all the time.
So, it will not affect your work or your daily living activities?
No.
Okay, so that's good. So, let's go.
Yeah.
Perform hand washing with antiseptic soap. Avoid contamination. Dry hands thoroughly from fingers to wrist. Perform the materials needed for the assessment.
For today, I will inspect the head of the patient. So, I already wash my hands. I already practice always hand washing with antiseptic soap. And I always practice hand sanitizing with using 70% alcohol. And we will use a non-sterile gloves. Okay, so let's start. I will check the size of the head and configuration or shape. The head of the patient is symmetrically. There is no present lesions and it is round and erect. For involuntary movement, the patient's head is still and upright. So I have to remove now my non-sterile gloves and apply antiseptic hand rub. And let's go further for the inspection of the patient's face. Okay, so I have to check the patient's face if it is symmetrically round, oblong, or oval. As I have observed, it is symmetric round, and there are no present abnormalities in her face. So, today I will inspect the patient's eyes if there is present edema or hollowness using my pen light. So far, there is no present edema or hollowness in her eyes. And let's go further for the facial movement, if there is abnormalities. Okay, ma'am? Okay, ma'am, can you please elevate your eyebrows, ma'am, and frown. Frown for me, ma'am. Lower your eyebrows. Close the eyes tightly for me, ma'am. Puff the cheeks. And smile. Show the teeth. Okay, thank you, ma'am. As I have observed, there are no present abnormalities in her facial movement. So let's move on. Let's go to palpating the patient temporal artery. So the patient temporal artery it is elastic and not tender. There is tenderness, ma'am.
None.
And we have to go further for the temporomandibular joint, which is the TMJ. Ma'am, just say if there is tenderness, okay?
Okay.
Please open your mouth for me, ma'am. Normally, there is no tenderness or swelling. And this time, we will go further for the patient's neck. We will assess if there is abnormalities or developing illnesses. First, I have to inspect the patient's neck using pen light. The patient's neck is symmetric and without bulging masses. Next is, I will inspect the movement of the neck structure of the patient. Okay, ma'am, can you please swallow a sip of water for me, ma'am? As I have observed, there is no abnormalities in the patient's thyroid gland as he swallowed a sip small of water. And today, I will inspect the cervical vertebrae of the patient. Okay, ma'am, can you please flex your neck for me, ma'am, from chin to chest? As I have observed, it is usually visible and palpable. So let's move on. So we will inspect the range of motion of the patient's neck for today. Okay, ma'am, can you please turn your head from left to right? Please touch your ear for me, ma'am, to your shoulder. Can you please look up for me, ma'am? Look down. Okay, so as I have observed, the movement of the patient's neck is smooth, naturally, and controlled. So let's move on and go further for the patient's trachea. I have to palpate the neck of the patient. So far, trachea is midline. Next is, I have to palpate the thyroid gland of the patient's neck. Find the hyoid bone, the thyroid cartilage, and the cricoid cartilage. Ma'am, can you please turn your head from left to right, ma'am? Okay, please go back. Can you please turn your head, look up. Look up. Look down, ma'am. Okay, so far, the landmark was positioned midline. Okay, this time, ma'am, please swallow for me. Again. Okay, it is normal. And this time, I will auscultate the patient's thyroid gland in order to know if there is any abnormal sound bruises. We will use the bell of the stethoscope. Please breathe for me, ma'am. Hold on. Again, the right side. Hold on. There are no present sound bruises or abnormal sound bruises And for the last time, we will palpate the lymph nodes of the head and neck of the patient in order for us to know if there is abnormalities. Okay, ma'am, can you please look at me, ma'am? And just say if there is tenderness, okay?
Okay.
Preocular nodes,
No.
post-auricular nodes,
None.
the tonsillar nodes,
None.
the submandibular nodes,
None.
the submental nodes,
None.
superficial cervical nodes,
None.
posterior cervical nodes,
None.
deep cervical chain nodes,
None.
supraclavicular nodes.
None.
As I have palpated the lymph nodes of the patient's head and neck, there is no present abnormalities or enlargement or tenderness. Thank you for your cooperation, ma'am. And I can assure you, ma'am, that the result will be confidential and it will be only discussed to other professional healthcare team. That would be all, ma'am, and thank you.
Thank you.
And that would be all. Thank you. Please don't forget to sanitize your hand.